Pro Group Management. Workers' comp that works for you.
Welcome to Nevada Newsmakers, coming to you from Carson City. On the broadcast today, Mason Van Houweling. He is the CEO of University Medical Center, here for the whole show on an all-new Nevada Newsmakers. Big R in Sparks is located on Bering Boulevard next to Smith's and across from Reed High School. It's a 50,000 square foot hardware store and a whole lot more. It's huge, with clothing, power equipment, tools, and of course, hardware. Big R is located on Bering Boulevard in Sparks, next to Smith's and opposite Reed High School. Big R, hardware, and a whole lot more.
It's the Lucky Lexus Cash and Free Play giveaways at Tamarack. Weekly cash and free play winners plus a $20,000 cash winner guarantee. And drive home a brand new Lexus NX30 or walk away with $42,500 in cash. It's a good time to win at Tamarack Casino.
As you know, Reno is booming. Toll's Development Company is helping it grow with insightful design and development, building community with every project, adding beauty, adding excitement, emphasizing our shared humanity. Reno is becoming bigger. Toll's Development is helping it become better, more livable, more enjoyable. To learn more, go to tollsdevelopment.com. tollsdevelopment.com.
When in Carson City, Nevada Newsmakers records in the conference room at the Bank Saloon. Coverage of the 2023 legislative session is brought to you by Liberty Dental Plan, making members shine one smile at a time. Pro Group Management, workers' comp that works for you. The Regional Transportation Commission of Washoe County, your RTC, our community. NV Energy, proudly serving Nevada, providing electricity to 2.4 million electric customers. And by Nevada Builders Alliance, building a better Nevada.
This is Nevada Newsmakers with host Sam Shad, a no-holds-barred political forum. Now, from the Nevada Newsmakers broadcast headquarters, here is Sam Shad.
And back on Nevada Newsmakers, coming to you from Carson City. Here we're at the Bank Saloon in the Conference Center, and I'm pleased to welcome back to the program Mason Van Houweling. He is the CEO of UMC, University Medical Center of Southern Nevada. Pleasure to have you back on the program, sir.
Thank you, Sam. Always good to be here with you and in Carson City today, and always good to talk to your listeners.
Well, thank you. Let's start out with, if we may, just to go back and reflect, COVID.
Sure.
Did you ever think in your career you were going to experience something like that?
I never did. Honestly, Sam, I've been through a lot through my career, both with my military background and 25 years of Air Force medicine, and obviously leading the largest public hospital in the state of Nevada. We've been through a lot, and some things never dreamed that I would be faced with. October 1, a cyber attack, the pandemic. But our team has always stepped up to the challenge. We're always kind of at the tip of the spear and running to the fight. So very proud of our team, how we responded, particularly at UMC, not only taking care of the patients, but also taking care of the state and developing policies and testing and treatments and therapeutics and just caring for those that really needed us at that time. So, but we're back to business and put that behind us, but always prepared for the next emergency and always staying ready.
And it seemed to me that one of the most important lessons for the public was that medicine is not something that is, we know everything and we can handle it all right now. It was a learning experience for everybody in the medical profession.
It really was, just not only locally for us, and I was really proud of how our state came together, both north and south, to collaborate. Certainly there's strong competition in healthcare and hospitals, but every day, every hour, every shift, we were coming together as colleagues to really do the best for our community. And as I reflect, and I've always said, I've been forever grateful for that period of shutdown for us to really prepare and again, we will always value that time. I know it was very tough for our state. We struggled with it as well, but it gave us time to really collaborate and prepare for, as you know, we were setting up large 900-bed convention center hospitals and thinking all kinds of things about ethics and treatments and therapeutics. So, but again, really proud of how we came together. It was a really good moment for us in healthcare.
And yesterday, as we're taping this, President Biden officially declared the emergency over.
That's correct. Yeah.
So that was very good news to hear.
Yes, yes.
So let's talk about what's going on here at the legislature. What are the biggest issues that you're facing with the legislature at this point in time?
Certainly putting on my Nevada Hospital Association hat and sitting on the executive board and the current past chair, we're always focused on moving forward healthcare in our state, providing more access, quality, controlling cost as best as we can. Certainly our state is growing at a rapid pace. And as you know, we've always struggled with delivering the healthcare because of staffing needs and access. So we're very focused on anything that can help grow providers, and I'm talking just not doctors, mid-levels, PAs, nurse practitioners, midwives, CRNAs, but also anything that can help grow more nurses in the state. One particular bill that we have that we're very proud of supporting is a nursing compact. So allowing nurses to what I call kind of a driver's license, to be able to have a state license in a primary residence, but also through a compact, allowing that nurse to be able to travel and be able to immediately start working versus getting separate licenses in each state. So that's one that we're hoping that will expedite care at the bedside and throughout our community. Also protecting our doctors. Obviously, today the medical malpractice bill is being heard. That particular one is a concern for the Nevada Hospital Association and the providers, which essentially increases the non-economic damages, allows for higher fees on trial attorneys, but also extends the statute of limitations. And we already have a fragile healthcare environment, and again, we think that will slow down the growth of physicians moving to the community, but also maybe turn some out of our state because of high insurance costs. And
this has been going on for over 20 years.
It has.
Keep Our Docs in Nevada was started right at the time we started Nevada Newsmakers, which is 21 years ago now.
Right. And that's exactly right. And that group is kind of reformed. And again, this is going to be a tough session in regards to that. But that's really our goal, is to not only keep our doctors, but also attract and retain new physicians to the community.
All right, so how are we doing with that? Because, with the state growing as rapidly as it is at both ends, I mean, Northern Nevada is on fire just as much as Southern Nevada is. And we've always been behind the curve in terms of being able to have enough doctors in all the different practices. How are we doing with that?
I think we're moving the needle. Certainly, as you said, the rapid growth throughout the state, Nevada is the destination, as it should be. But I think we're growing. UMC in particular, we've got a very high program around residents and medical students and fellowships. Both UNR and UNLV is doing a great job. We've got a lot of great private medical schools out there with Toro and Roseman, all pursuing to grow medical students. So, but it's never fast enough, right? And I think part of it is we need to grow the residencies here in the state. So if you have a medical student, certainly you want them to do a residency, but you have to have those residencies and slots here. And we're still kind of woefully inadequate in some of those residencies. So students leave, do the residencies, and often where you're at with your residency, you stay in that community.
Where you stay.
You get recruited.
So what do we do to fix that?
There's a lot of work being on the federal level, and our senators and our representatives are helping with that, what's called graduate medical education, the expansion, making sure Nevada gets its fair share of GME slots as we grow. Unfortunately, on the East Coast, where a lot of medical schools were started, and the West is fairly newer, those slots haven't moved in equal population growth. So as programs do close throughout the country, we're trying to get those slots to Nevada. So we've got very good federal support on that, and the lawmakers are very aware of the issue, but both deans of the medical schools are doing a great job on advocating for that.
But a big difference between now and, say, Kenny Gwynn's time in office in Nevada is that back then, even the governor was going out of state for medical care. That doesn't appear to be the case anymore.
I think we're really moving forward as far as the state, both in the north and the south. In UMC in particular, we have really grown in some of our specialty service. Orthopedics, I'm very happy to say that we probably have one of the largest, if not largest, orthopedic practices at UMC on our campus. which is really helping take care of some of the most complex orthopedic and spine cases. To be able to keep Nevadans here, both on an outpatient basis, but also an inpatient basis. So that's one thing. We are Nevada and Las Vegas, and UMC has doubled down on our cardiovascular care with our trusted partners with Nevada Heart and Vascular. We made some significant capital investments, more clinical improvements, just continue to grow that service line for us, and I truly believe UMC will be the heart hospital in Nevada here very shortly.
Well, as somebody who requires those kind of services, I'm very happy to hear that. One of the things that came through with COVID, and I'm hoping that it will continue on in a much bigger way, is telemedicine. Not just in the major markets, but also for rural Nevada. What's your thoughts on that?
It's extremely important, Sam. I can't highlight that enough. And yesterday there were some bills being heard on telemedicine, and obviously with some of the emergency regulations and during COVID, that really fast forwarded telehealth, online care. In fact, UMC was not in that space during pre-COVID. We expanded that service line, and I'm happy to report any Nevadan can go onto UMC Online Care, download our app, and get care both on the primary care side, but also kind of urgent care side as well. For things like cold, flu, respiratory issues, abdominal pains, and many, many other things. But I think it's extremely important to be able to seek care from wherever you're at in the state. And looking at our numbers, anywhere from a 5 to 7 minute wait time and a 8-minute provider interaction, and the satisfaction scores are really, really high. And we're seeing that continued growth versus going into your traditional urgent care or your primary care office. So it's not the complete solution, but it certainly helps us augment patient care in the community. But again, rural Nevada, it's a great option. And for us to have the strength of UMC with all of our subspecialties and high-level care, we can back that up.
Yeah, and I mean, it just seems crazy that if somebody's in Elko or in Lincoln County and they need medical services, a prescription renewed, for example, that they were having to make, an hour's journey, multiple hours journey, then sit in a doctor's waiting office. It seems the efficiencies just there alone saves everybody money and makes the doctor's offices much more efficient, so they can do more about taking care of people rather than people sitting around waiting.
You're exactly right, Sam. We've made it so easy now to be able to go online, have a discussion with your physician, talk about whatever is bothering you or symptomatic, and then it's so easy to get the prescription to whatever pharmacy you have right around the corner. So again, I think it's just an important part of patient care, and that's what our customers are asking for. So we continue to hope to and advocate and educate for support on telehealth services in the state of Nevada, and we're all aligned on that. I can't see how you could be against that, but unfortunately there are those that are.
Really?
That want to slow.
What's the objection?
Yeah, it's again, I'm still trying to figure it out, but we will always continue to work with those and groups that have concerns. But lifting some of the emergency provisions roll us back on telehealth. So we're trying to keep those in place, but there's always education that needs to happen out there. But again, I think it's extremely important. It's not going to solve everything, but for those routine visits that you talked about and convenience, and just the value of everyone's time, it just makes total sense in today's environment.
One goofy example, and this was during COVID, was I needed to get a prescription refill. I set it up with the doctor's office to call at a certain time. I was not in Reno, I was in San Diego at a restaurant. I went out to my car, had the appointment with the doctor for the 5 minutes. I got my prescription. I wasn't even in town.
Yeah, that's what we want, and we want to make it easier for our patients, and then make it more effective for those that need the higher level of care that don't have to go for those routine visits. But that's a perfect example of what we would like to do, and we hope that business continues to grow. I see it growing exponentially for UMC, as do many other healthcare providers.
What do you see as the future for that? I mean, what kind of exams potentially down the road here that could be done online that now require a visit that could save so many people so much time?
I think certainly things that are routine, even primary care visits. We're doing primary care visits via telehealth now. And so again, there's nothing that can substitute the face-to-face interaction and the discussion, and but we certainly are able to address a lot of things via telehealth that saves everyone time. And we've got doctors throughout the community that are doing that 24/7, and that's the other thing is it's 24/7. A lot of offices close, and unfortunately patients have to go to the emergency department, which is the last place we want people to go.
Sure.
It's unfortunately sometimes chaotic.
And the most expensive.
And the most expensive. And again, we are committed to trying to drive down the cost of healthcare. We do not like seeing that passed on to the employers, who unfortunately pass that on to the patients. So again, I think it's just another avenue to control cost and offer an alternative to patient care.
You were very much involved with the previous governor. Have you had interactions with our current governor and discussions?
Sure, and again, Governor Sisolak, he appointed me and was very supportive of UMC, but all of our hospitals in Nevada. I serve as a patient protection commissioner and very proud to carry out the work with that commission. And we've got 3 bills that are currently in the legislative body that are working their way through. Governor Lombardo has certainly reached out to the healthcare community. He did during his campaign and met with the association quite a bit. And so we look forward to continuing that relationship. And I think healthcare should not be a divisive issue on either party. So as long as we're continue to improve access, improve quality and outcomes, and control costs, I think we're doing a good job.
So at this point, the good news is that when you go to the doctor's office, they don't ask you which political party you belong to before they treat you. I like that.
Absolutely.
All right, let's take a break. We'll be back with Mason Van Houweling after this timeout.
Remember 2010 in northern Nevada, 13 to 14% unemployment, thousands of homes in foreclosure, Nevada's casinos closing? Families in the Reno-Sparks area were hurting. Many were losing everything. Then Story County launched a game changer for our region, a public-private industrial partnership, streamlined permitting, /bureaucracy, attracting Fortune 500 companies that made Nevada their home. Story County generated a river of cash to area communities. Economic studies by the state and others for the Gigafactory consistently show positive economic benefits for our region. $4 billion in local wages, $17 billion in consumer spending and economic activity, over $100 million in taxes to Washoe, Story, Reno, Sparks, and Nevada, just for the Gigafactory alone. Story County, improving northern Nevada one industry at a time.
The Nevada Builders Alliance has been protecting the interests of the construction industry for over 50 years. Our programs save members thousands of dollars every year and allow them to provide much-needed benefits to their employees. Our industry also allows Nevada to grow. If you're thinking about a career in the construction industry, reach out. And if you haven't thought of a career in construction, what are you waiting for? We are the Nevada Builders Alliance.
Located in the heart of Carson City, the Bank Saloon is a historic watering hole with a modern feel. With a variety of classic cocktails featuring Nevada spirits, space for private events, conferences, and an incredible atmosphere, the Bank Saloon offers a great location to work and play. Come visit us. Located at the corner of 5th and Carson, we'll save you a drink.
Carson Valley Inn, it's your place for the good times. Carson Valley Inn.
This is Nevada Newsmakers.
And back on Nevada Newsmakers, we continue our conversation with Mason Van Houweling. He's the CEO of University Medical Center, the largest hospital in the state of Nevada. The UMC Center for Transplantation recently ranked first in the nation for its kidney transplant outcomes and the shortest amount of wait time for transplants. How were you able to do this? Because this is not an easy thing to have accomplished.
Sure, and happy, Sam, to talk about our transplant center, which is the only transplant center in the state of Nevada. They've been doing really world-class work there, and we've invested a lot in our physicians, our staff, our nurses, and happy to report that UMC's transplant center, out of 257 transplant centers around kidneys, is the #1 in the nation, not only in one category, but two. which I think are probably the most important. Survivability rate. So we're several percent.
The most important.
Yeah. Yes. Yeah. I once I saw that and the team told me, extremely proud of the outcomes that this dedicated team has been able to do, and certainly that hasn't happened overnight. And we're going to continue to work hard in transplantation for the entire state. But yeah, survivability, top of the list. And then also a very important indicator for if you're a patient is the time to transplant. Once you get on a wait list, how long does it actually take to actually receive a transplant?
And what is the time frame?
So typically in major cities and other parts of the country, it could be 8 to 10 years, which obviously is a lifetime for somebody that is very worried about themselves, their families. But happy to report UMC is around 18 to 20 months. So obviously the survivability, but also time to transplant, and we're able to move very quickly because of our network, and our team around the clock is working very diligently for this patient population. Also very happy to report that we are now doing pancreas transplants, so which has added a service line, and we're also on a journey to do livers. So we're meeting weekly about that and how do we bring liver transplants to the entire state of Nevada. But again, world-class team.
You're looking at through the entire state.
Well, obviously we pull, so we, Nevada, we take care of all Nevadans when it comes to kidney transplants and pancreas transplants, but certainly we're moving forward with expanding to liver transplants, which is a heavy lift, quite frankly. It's a lot of investments, a lot of expertise, a lot of commitment with all of our community partners, but everyone's stepping up to the table and working with us to be able to hopefully provide that over the next several years.
All right, well, let's take another break and we'll be right back.
Save money and take transit. Did you know you can ride the bus all day for less than what it would cost you for a gallon of gas? Plan your trip now by going to rtcwashoe.com.
The Do It Right guys at Nevada Heating have one mission. Your furnace breaks down today? We fix it today. Why freeze for days while your furnace is down when Nevada Heating can get the job done today and you can get warm again? For nearly 50 years, locally owned Nevada Heating has been getting the job done right. Call today at 323-5585 and we'll fix it today. That's 323-5585 or online at nevadaheating.com.
Come join the month-long celebration during the Carson Valley Inn 13th Anniversary Giveaways with guaranteed $1,000 winners every drawing night and a $13,000 grand prize winner guaranteed. Come celebrate with us during the 13th Anniversary Giveaways at the Carson Valley Inn.
Pro Group Management offers workers' comp services to a growing number of industries. As businesses grow and change with the times, the need for a solid workers' comp program must be flexible and up to date. The evolving nature of regulations can make staying ahead of complex tasks challenging. But Pro Group Management simplifies the work so your industry can move forward and succeed. Pro Group Management, workers' comp that works for you.
This is Nevada Newsmakers.
And back on Nevada Newsmakers, we continue our conversation with Mason Van Houweling. He's the CEO of University Medical Center. You're still expanding your footprint in Southern Nevada. It's not like you're not huge already. Right. But what areas are you expanding into now? So
a couple of things. Let me start with our ambulatory division, which is beyond our 1800 West Charleston. This is out in the community, and we think that's a very important approach for us. We talked about telehealth a little bit earlier, but we're trying to get into neighborhoods. We have been since the late 80s, and UMC has really been a pioneer in the urgent care space. Our UMC quick...
So this is the Aliante?
Well, yes, Aliante, which is kind of a northern part of Las Vegas that continues to grow out there by Nellis Air Force Base and Centennial Hills and moving towards Mount Charleston area. Huge population growth out there, kind of on the northern beltway, 215. So our ambulatory division is growing. Aliante, we've recently opened both a primary care and a quick care. This is really offering care in the neighborhood, but also serves as a gateway should you need a higher level of care back at University Medical Center. So we're excited about that. Our Southern Highlands, which is kind of the southeast, but we're going to continue to grow throughout the community. We think it's an important alternative to the emergency departments. It's much less costly, and we really have some great outcomes.
And The surprising one is the airport.
Yes.
Harry
yes.
Reid. So what's going on there?
Yeah, we've been in that space. We were, during the COVID period, we decided to expand into the LAX airport, Harry Reid Airport. So we've got travelers, if you're coming or going, we're able to treat those patients coming into the community, so you don't have to go out and try to find an urgent care. So that's been working really well for us, and we do a lot of telehealth out of there as well. So, but yeah, that's an important division for us, and we'll continue to grow with our community.
And last quick question here is, you're a finance guy.
Yep.
After COVID and all that you had to go through, how are the finances? Because you had brought UMC from 0 to 100. Where are you now?
We continue to do really well, Sam. I'm very happy to report through really good business acumen and diligence with our team, but really delivering a great product to our community. We're very in high demand. So hospital finances are really continue to be not only hitting our budgets, but cash flow positive and exceeding our budget. So again, what I'm happy to report is all of that gets reinvested back at UMC directly. We don't have shareholders back in Wall Street or other corporate offices outside of the state. So I'm very proud that that reinvestment gets right back in. And I always say, instead of shareholders, we have careholders in our community. And again, happy to report that that investment continues to happen at UMC.
And that's where we have to leave it. Always a pleasure to see you, sir. Thank you.
Thank you, Sam. Appreciate it. Thank you.
And we'll be right back.
Like a traditional handmade basket, retail is woven into the fabric of life in Nevada. From big box to mom and pop, retail supports our communities in countless ways. Jobs for the disabled, team uniforms for kids, help for the elderly, and so much more. Retail employs over 1 in 10 workers. Retail supports Nevada, and we support retail.
RANNV.org.
Imagine a magical garden that feeds Carson City's hungry and homeless, teaches our high school students agriculture, creates hanging floral displays to beautify downtown, and yet charges nothing. It's not magic. It's the Greenhouse Project. It's real, it's growing, and it needs your help. Go online to carsоncitygreenhouse.org so together we can grow it forward.
What do you count on? You count on your power every day. At NV Energy, we've always powered what's important to you, but we're not looking at the past. We're focused on the future. While our standards are high, our rates will remain low. And our commitment to renewables isn't just meeting standards, but leading the way. Because you can count on more than just your power. You can count on the company who brings it to you. That's our promise. You can count on it.
When in Carson City, Nevada Newsmakers records in the conference room at the Bank Saloon. Coverage of the 2023 legislative session is brought to you by Liberty Dental Plan, making members shine one smile at a time. Pro Group Management, workers' comp that works for you. The Regional Transportation Commission of Washoe County, your RTC, our community. NV Energy, proudly serving Nevada, providing electricity to 2.4 million electric customers. And by Nevada Builders Alliance, building a better Nevada.
Our thanks to the Bank Saloon in Carson City and the Builders Alliance for their help with our coverage of the 2023 legislative session. We'll see you on the next Friday.